Hi, my name is Skip Stewart. I'm the Chief Improvement Officer for Baptist Memorial Healthcare. And today we want to talk about strategic deployment and alignment, which is a major piece of what we call the Baptist Management System. Today I'm with CEO Brad Parsons of NEA Baptist. Brad, can you tell us a little bit about NEA Baptist?
Absolutely. Thank you, Skip. NEA Baptist is a 228-bed hospital with a multi-specialty group practice of 100 physicians and 40 advanced practice providers. We have over 1,900 employees at NEA Baptist, and so we were looking for a way to have a management system that we could align, deploy, and engage the important work of our organization to all levels. So we've really used strategic deployment as a key part of that management system.
Well, we're in this room called the Safe Room. I know some people like Toyota have a room they call an Obeya room. Sometimes people will have a room they call a war room or a think tank, but we call this room the Safe Room. Tell us a little bit about this room.
Yeah, so the Safe Room is a place that we can come and think, that we can come and really strategize about the important work of our organization. And so we had some great coaches from Lean Pathways that helped us really develop the layout of this board. And this room is really an industrial space that we now use as a think tank really for our organization. And so when we look at this board, it's really important that we have some of the key elements in place, starting with a true north statement that we have at the top, improving healthcare for our patients. And so this is something that we really wrestled with about something that will resonate with our leadership, but also our entire staff at NEA Baptist. Why are we here and what motivates us to do the work we do every day? It's really about improving care for our patients.
Well, one of the things I noticed that you have is throughout all of Baptist, we have a strategic initiative or a strategic direction that we call providing patients with the right care at the right time, the right place, and the right cost. I also noticed that under each one of those categories, we have a column or a pillar that deals with a strategic gap that we're trying to kind of shut. Explain a little bit about that.
Yeah, so the next really layer of our board is our strategy. And like Skip said, our strategy is not just here at NEA Baptist, but for the entire Baptist organization that covers 3 states. And our strategy is to deliver the right care at the right time, at the right place, and at the right cost. A lot of work went into this strategy. That strategy resonates with, most importantly, our customers. And that's the patients that we take care of, our patients and their families, that we want to deliver that strategy for. We've also learned that it resonates with our employees and our leaders, because we know that in healthcare that it's really around delivering the right care at the right time, at the right place, and the right cost. So when you look at our board, you see strategies in each of the rights. And you don't just see one strategy. So as we've evolved in our management system and in our thinking around the imperatives for our organization, you can see that today we have 3 strategies under right care. And we'll talk a lot more in depth as we go through the board about those strategies, but we have a strategy in patient experience, a strategy in quality and safety, and a new strategy around population health that we call care management, all within the right care domain for this board.
So as we look at these columns or these strategic gaps, I know that y'all have a thought leader or a key thinker that's connected. I also noticed that you have 3 different layers, the strategic A3, which is different than a problem-solving A3, and then you have a status A3, and then you have a set of metrics. Tell us a little more about that.
Yeah, so we have thought leaders for each of these strategic A3s that you see. And that's important because you have to have somebody that's keeping track of the important work that you've got to close or the gaps that you have to close through the year. And so as we begin, and we'll talk in more depth about the strategic A3, but there's elements that you build and catch ball that we play with leaders across the organization to make sure that these strategies are what we need to accomplish as an organization. And then as you move down the board into the status A3, this is the ongoing work. So these documents become a static document, And the status A3 really becomes the work of each period throughout the year. So this is the ongoing work of the organization that you see, and you see this build throughout the year. Because not everything that we hypothesized early in the year actually will transpire. So we're not going to bat 1,000. We're going to have some of our strategies that really work and some of the strategies that don't work. And that thinking and what we learn as we go is reflected in the status A3. And then ultimately, we also want to have a very quick way that we can see, are we doing the work that we need to be doing? We've learned a lot about the value of visual management, and we use this here in these visual graphs to see very quickly at a glance, are things tracking like we need them to track, or do we need to dig in further to see what's happening there?
So let's talk a little bit about the strategy A3. As you know, Brad, we have a little tool that we give folks, and it's on what to fill out. And the strategy A3 has 5 parts. The left side is the plan of the plan, do, study, adjust, and the right side is the do and the study and adjust. Let's kind of walk through those 5 parts on what, at a high level, what makes up each part of the strategy A3.
So the first part of the strategic A3 is the top left box, and it's called the gap. So what gap are you trying to close? Now, when we say a gap, sometimes we use the terminology of goals that we need to accomplish. So the gap is simply the goal that we need to accomplish and where we are today. That creates a gap. And so we want to close that gap with the work of this document. This document is going to help direct the work throughout the year on the things that we must do to close that gap. That's the top left box. What is the gap? The second box is a very important piece, which is really reflecting on what has transpired or what we have learned that has brought us to this point. And so the reflection area allows us to say, what has worked well in the last year? What did we learn that didn't work so well? And what do we need to glean from that in developing strategies for go forward? So the reflection area is something that has become richer for our organization as we get further into a lean management system. And finally, on the left side is the bottom box, which is a set of hypotheses. These are the things or the strategies that we believe will help us close that strategic gap. All of our hypotheses are built with an if-then statement. So if we do this, then we believe this will occur. The hypotheses, each one should be a portion of the gap that we're trying to close. And we should have enough hypotheses to more than close the gap. Again, because we know in our business and in any business, not every strategy is going to pan out exactly like you think it will. So therefore, we want to have more hypotheses than is needed to close that strategic gap.
That's really, really good, Brad. So that's step 1, 2, and 3. That's the left side of the strategy A3. But then as we move to the right side, the do and then the study and adjust, as we move towards the do, there's a lot of this thing that we call catch ball that has to occur to help develop that. Talk a little bit about that.